12 reasons why you have cramps but no period. Having abdominal and pelvic cramps but no period to follow can be a cause for concern. While harmless triggers like monthly ovulation and implantation of a fertilized egg can cause cramps, more serious implications are endometriosis, appendicitis, ovarian cysts and tumors, and digestive disorders like IBS and IBD. If you are pregnant, do not ignore one-sided cramps that accompany regular spotting. Cramps are never nice, but those that crop up just before your period or during your period are absolutely normal. They're caused when prostaglandin, a hormone-like compound, contracts the muscles of the uterus to discard an unfertilized egg along with the uterus lining. However, what if you have cramps but no period? The possible reasons are many, ranging from ovulation and implantation to appendicitis and cancer. Menstrual cramps are expected before you start your period. When the cramps show up as anticipated but your period does not, you may feel thrown off guard. If such is the case, here are some reasons why you may be cramping. 1. Ovulation. Often, cramps without period is a lot less serious than pregnancy. Some women experience cramping on one side of their lower abdomen before, during, or after an egg is released from their ovary. The process is known as ovulation, and ovulation pain is called Mittelschmerz. Ovulation pain is usually not a cause for concern, unless, of course, it is severe, which is very rare. The side of the pain depends on the ovary which releases the egg and can, thus, change from one month to the other. The intensity of cramping differs from person to person. It can be dull or sharp. Cramps usually last from a few minutes to a few hours but can persist up to 24 to 48 hours. In an average 28-day menstrual cycle, cramping can occur 10 to 14 days before the start of the period. 2. Miscarriage. The loss of an unborn baby before the 20th week of pregnancy is called a miscarriage. Abdominal pain or cramping is one sign of it. The cramps may begin as mild period-like pain, with heaviness in the thighs and lower abdomen, and escalate into severe cramps and bleeding. While vaginal bleeding is a sign of miscarriage, if the bleeding is not heavy, it's easy to mistake it as regular early pregnancy spotting. It is important to know that mild or period-like pain is normal during pregnancy, but if the pain persists or gets severe with time, inform your doctor. 3. Endometriosis. Endometriosis is a condition where the endometrium or the tissue lining the inside of the uterus grows outside. The tissues usually grow in the ovaries, fallopian tubes, the outer surface of the uterus, and the tissues supporting the uterus. Female hormones are unable to recognize that these tissues are not in the uterus and treat them as regular uterine tissues. This results in painful cramps. Endometrial cramps can occur at any time of the month, as and when the tissues grow. They may delay your periods, increasing your blood flow and discomfort during Shark Week. Cramps can be felt in the lower abdomen, lower back, and pelvic areas. Endometriosis is one of the reasons for infertility. 4. Perimenopause. Menopause is the permanent cessation of the menstrual cycle in a woman's life, indicating the end of her fertility phase. It usually sets in between the ages 40 and 51. In the phase leading up to menopause, called the perimenopause phase, many women experience irregular periods and sometimes even miss their periods for a couple of months. In the months that they do not have their period, some women continue to have menstrual cramps during the time their periods would normally occur. Loss of libido, lack of sleep, night sweats, and weight gain often come with the cramps. 5. Stenosis of the uterine cervix. If you have had surgery done on the cervix or have experienced cervical trauma, your painful cramps sans period could indicate stenosis of the uterine cervix. 7. In this condition, the opening of the uterus, cervix, narrows to the extent that normal menstrual bleeding is obstructed. This leads to severe cramping without the occurrence of periods. In some instances, periods may be regular but with lesser bleeding and painful cramps. 6. Ovarian cysts. Fluid-filled sacs that develop in the ovaries are called ovarian cysts. These sacs can form in two cases. When the egg is not released from the follicle. When the follicle doesn't dissolve after the egg is released. Ovarian cysts can cause a sharp pain just below the belly button, on the side of the ovary which has a cyst, and or a dull ache in the lower back and thighs. If the cysts twist the ovary, the pain may also be accompanied by nausea and vomiting. 7. Ovarian cancer. Ovarian cancer can cause abdominal or pelvic cramping along with pain in the legs and lower back. 9. It might be mild at the beginning but tends to intensify with time, mimicking constipation or gas. In some cases, there might be mild spotting as well, and it can happen at any time of the month. There is persistent pressure on your lower abdomen, which doesn't subside. Accompanying symptoms include swelling of the belly, constipation, feeling full with smaller meals, and frequent urination. 8. Irritable bowel syndrome. If you have irritable bowel syndrome, IBS, you may get cramps any time of the month. This intestinal disorder causes pain and bloating in the stomach along with constipation and or diarrhea for at least 3 months. 10. You would get a sharp pain in the abdomen every time you have to defecate or whenever you are constipated. The cramps may reduce after the passage of stool but may worsen during menstruation. 9. Inflammatory bowel disease. Inflammatory bowel disease is a condition where a part of the gastrointestinal, GI, tract becomes inflamed. Two common types of IBD are Crohn's disease and ulcerative colitis. While Crohn's disease may affect any part of the GI tract, ulcerative colitis affects only the large intestines. 11. Cramps may arise in the lower left, lower right, or middle of the abdomen depending on the type of inflammatory bowel disease. 10. Pelvic inflammatory disease. Pelvic inflammatory disease is a bacterial infection that can be contracted through sexual intercourse. It may even be caused by normal bacteria thriving in the vagina. It affects the uterus, ovaries, fallopian tubes, and cervix. Cramping in the lower abdomen is the most common sign of PID. Cramps may appear at any time of the month, not just around your regular period week. 12. Painful sex and painful urination are other telltale signs. Untreated pelvic inflammatory disease can lead to infertility, ectopic pregnancy, and pelvic pain that does not go away. 11. Appendicitis. This is one of the more well-known suspects of abdominal cramps. The appendix is a small organ present in the lower right abdomen, at the junction of the small and large intestines. Inflammation of this vestigial organ is called appendicitis. The cramps usually originate around your belly button and come and go. Within hours, the pain radiates toward the lower right abdomen and becomes more constant. The pain can quickly intensify and become unbearable, calling for immediate medical attention. 12. Autoimmune arthritis. Autoimmune arthritis is a rare condition where the body's immune system attacks the ovaries, misidentifying them as foreign bodies. This makes the ovaries non-functional, causing them to harden and shrink. The levels of female hormones produced by the ovaries, thus, take a hit. This results in abdominal cramping and irregular or absent periods. A person may also become infertile because of this condition. Besides the reasons mentioned, stress, a sedentary lifestyle, and eating disorders like bulimia and anorexia can also cause cramps without periods showing up. When to see a doctor? Seek medical help immediately if the cramps become severe or constant, despite the time of the month. If your cramps keep cropping up despite irregular or absent periods and you are not pregnant, let your doctor know about it. If you are pregnant, watch out for cramps that occur only on one side and those that accompany bleeding or spotting. Speak to your doctor when it happens. Tips to relieve cramps. For mild abdominal and pelvic cramps that come and go, Here are a few temporary relief measures you can try. Place a heating pad or a hot water bottle on the affected area for some time. Lie down till the pain subsides. Drink a warm beverage like some warm milk or green tea. Soak yourself and relax for a while in a tub of hot water.
Thank you for every like, share and comment, and don't forget to click the subscribe button to our channel.